Hello everyone, let's look at the TNM classification of gastric cancer. So again, the basic concept is that we need to remember the layers of the GI tract wall. So mucosa, submucosa, muscularis propria and serosa. So whenever the tumor is involving mucosa and submucosa, it is T1. Whenever it is involving muscularis propria, that is T2. So muscularis propria will come under T2. And T3 is nothing but subserosal tissue, that is just beneath the serosa. Then whenever it is invading the serosa or the adjacent structures to the stomach, it is T4. And we need to remember one important point here. These adjacent structure does not include esophagus or duodenum. Even though the continuation of esophagus is the stomach and stomach is continuing as duodenum, but these two structures will not come under the concept or the entity of adjacent structures. Okay, right. So coming to nodal grading, so 1 to 2 lymph nodes will be N1, 3 to 6 lymph nodes will be N2, and 7 to 15 will be N3A. More than or equal to 16 lymph nodes will be N3B. Okay. Please understand the nodal grading is related to whatever the regional lymph nodes that are draining the stomach. For example, paragastric or perigastric, and whatever the lymph nodes that are around the main vessels like celiac trunk, left gastric artery, splenic hilum, and also the splenic artery, etc. etc. But whenever it is involving non-regional intra-abdominal lymph nodes, that will be considered as M1 metastasis. So what are the non-regional lymph nodes? Retropancreatic, mesenteric, and para-aortic groups are considered as non-regional lymph nodes. So whenever there is involvement of these lymph nodes, it is considered as metastasis M1. Also, whenever there is involvement of liver or whenever we have got peritoneal seedling, that is nothing but metastasis of the peritoneum, that is also considered as M1. So let's understand by looking at this picture about this TNM classification again. So we can see here after the high grade dysplasia, T1A is your involving mainly mucosa, whereas T1B is submucosa. We can see here T1B is submucosa. T2 is nothing but it is involving the muscularis propria. Muscularis propria. And T3, as you can see here in the picture, this is the subserosa. So subserosa involvement is nothing but T3. And T4A and T4B both will come under. T4A is serosa involvement, T4B will be adjacent structures. And which structures do not come under adjacent structures? Esophagus and duodenum. They will not come under adjacent structures. Okay, right. Thank you.